Let's hop right to them. We have 497 patients in here as of midnight. Of those 497 patients, 59 of them are being treated for COVID-19. As you can see from the level of care on the next slide, things are certainly improving. That 6 of these patients are in the intensive care unit, and only 4 of them are currently on ventilators. The rest are between progressive care and general care. As we go to our final slide in our routine statistical representation, you can see that greater Nebraska, parts of northern Kansas appear to be doing much, much better. So most of our patients are from right here in Lancaster County at this point in time. Before Dr. Johnson gets up here, I just wanted to give you a quick update on some changes to the Bryan drive-through. It is currently located in the old Graham Tire building on O Street. If you recall, it was the first drive-through testing site that was opened up on March 24th, 2020. To date, over 20,000 tests had been administered there, and it was really through much of May when about 75-80% of all of the testing in the area was being done by Bryan and heavily at the drive-through. We are going to begin pulling back that service, and it will end on February 5th. COVID testing will still be available at all of our urgent care locations. We have it at our North Point Clinic on North 27th Street, 84th and Pioneers, Southeast Family Medicine, and then the Bryan Urgent Care down at Life Point. They'll all still be available then. But what has really precipitated this is declining numbers in the area, in combination with vastly more testing options. Again, we were in good shape as far as the percentage that we were supplying to the community through May, and then as more and more things have come online, thankfully people now have more options. I would just like to thank the team that dedicated their time and talents to that. You guys might not know, but the Nebraska Hospital Association honored our drive-through with their Quest for Excellence Award this past August for all of their efforts that they did to be the first and a pretty assertive testing program for our community. So with that, I'm going to turn it over to Dr. Bill Johnson, pulmonologist on our medical staff here, talk a little bit about the vaccination, and then we will open it up to questions that you have. Thank you.
Thanks for letting me come talk with you. I'm Dr. Bill Johnson. I'm a pulmonary critical care doc. I'm the director of our intensivist program here and vice chief of staff at Bryan as well. The thing I wanted to maybe touch on with the vaccines has to do with a topic known as vaccine hesitancy. And so I'm up here to try to hopefully allay fears and maybe talk people into getting a vaccine. If we look at COVID over the last year, and I remember talking to you back in May of this last year about wearing a mask and pretty much pleading for people to wear a mask at that time, and there was no vaccine in sight at that point. And having a vaccine available is just been a fantastic thing for all of us. Now it's getting people to get the shot, and there's a lot of aspects behind that. But one of those things also has to be with somewhat of the general public's hesitancy towards it, and I wanted to touch on that. Reminding everybody, COVID has been pretty much the perfect pandemic. Talk about a virus that will spread without people even knowing they have it, and yet there's 400,000 deaths. And I have to wonder if people would maybe do things differently if it had 100% mortality. And if we had 400,000 deaths and a virus that had 100% mortality, I'm guessing people might act differently. Those 400,000 people that died, their mortality rate was 100% for each one of them. When it comes to fighting a virus, in general, it's a challenge. Viruses work on our own cellular metabolism and structure and our own DNA. People talk about DNA. If you don't want something to disrupt your DNA, don't get a virus. That's the way it replicates, is it uses your own cellular metabolism, as opposed to, say, a bacteria that has a cell wall and we can use an antibiotic that will just kill just the bacteria. Antivirals will tend to have a lot of toxicity to it because it's very hard to control them because it affects your own cellular metabolism too. Vaccines have traditionally been the best way that we have to fight a virus. And I've said before, imagine a world without vaccines. Smallpox, measles, polio, we don't have to worry about those because of vaccines. And right now, we need to get one vaccine into everybody, and that's very important here. And I don't want to strike on social media or politics or anything, but people that have been against vaccines have always been able to hide behind the fact that the rest of us get a vaccine. And so diseases like polio and measles are not prevalent in the community, mainly because the rest of us have gotten vaccines. And unfortunately, that's not the case with COVID. And that's why we really need to get people out and get it. I've heard people say that, well, I don't want to get it because I want to let someone else get it, get the vaccine first. And that's really not the way we want you to go about it. I'll explain a little bit later how to register, how we want you to register for it. But if your time comes up, go get your vaccine. I think there are about three types of people out there. There are those out there that they say, fine, I'll go get it. Just tell me when, where, how. There are those that they're just not going to get it no matter what you say. But then I think a lot of people have questions. They just want to know, is this okay? How did it happen so fast? And that's where I want to remind people on that, the concept of recombinant protein synthesis is not new technology. This has been around for a long time, probably almost up to 100 years where they started talking about genetic type of work. But the recombinant protein synthesis, we use this all the time in medicine. Those of you that take human insulin, that's recombinant technology. We're just doing it a little different place down the road when we use an mRNA vaccine. I'll mention farmers use recombinant technology. If you are growing Roundup resistant corn, you're using recombinant technology. So this is something we all use. The aspect of COVID, remember SARS and MERS were coronaviruses, and there were actually vaccine work that was done on those viruses 10 years ago. And so we had some ability to go back on that. They had a vaccine developing with SARS, which is SARS-CoV-1. It didn't have to be used because thankfully that virus tended to go away. Unfortunately, COVID did not. And it's here and it's going to run through our population, whether we have infected population or we get vaccinated population. And I think that's the part that's the sobering aspect to it. Without a vaccine, I think right now we're at somewhere around 25 million cases that have been reported. Obviously, we assume there's more people that have had COVID than are tested positive, but I don't think that there's 20% of our population that probably has had COVID yet. And no matter what, somehow, some way, that entire population has to get some form of immunity to it, whether that be with disease or whether that be with a vaccine. And I want to show you why it's a lot better to do that with a vaccine. Here on this first slide, these are the Moderna and Pfizer vaccines. And boy, I tell you that I think that there were healthcare people jumping up and down when they saw this type of efficacy. What you're looking at here, the line that's going up is a group of people who got a placebo and did not get the vaccine. And the other line is the people who got the vaccine. And remember, the endpoint on here was clinically relevant or clinical disease. It was not necessarily tested disease, but those who had clinical disease. You'll see that, for instance, on the Pfizer vaccine, the blue line kind of follows along the curve until about day 7 to 10, and then it straightens out. And this is from day 1. Now, the second shot falls in there midway, but still, when you have this type of efficacy on a vaccine first time around, this is fantastic. People worry about the safety. And if you go to the next slide, you know, if you're just out in the general public and you think that I have a very low risk for having troubles with COVID anyway. Well, your bar is on the far right compared to if you were to get the vaccine. Your risk of having a serious vaccine reaction with the mRNA vaccines is far less, about 100-fold at least less than having any trouble with COVID at all. And so, again, the risk of this vaccine is very low. I talk about the development of this. If you were to think about going to a bank and you have a bank account at a certain bank, think of your bank account as your own DNA. If you go in and you take a check in to cash at your bank, they just give you the cash. They don't touch your bank account. They give you the money you need. And that's kind of what the mRNA vaccine does. It's on the other side of the DNA. It's on the side of the DNA where it doesn't even touch it. It just tells your body to develop a particular protein, and then it's gone. And then that protein causes your body to develop an immune response as if you had been exposed to COVID. And now all of a sudden, without ever getting the disease, you now have an immunity to it. You know, a picture can be worth 1,000 words, and I think that this one really tells a lot. If you look at the top part, people that are in red have COVID and have the disease, and the rest of people have never been exposed. And if we don't have a vaccine at some point, everybody's going to get infected. And that 400,000 number of deaths invariably is going to go up. And they're already talking about 500,000 and 600,000. And that's in the face of a vaccine. That's a sobering slide to think of what happens. And that talk of herd immunity by disease, that's just a catastrophe. And so the next slide down is one where, well, what if some people get immunized? And that's where I want to try to steer us away from that. There are people that are saying that, well, I'll wait, I'll let other people get the vaccine, or I want to wait and see what happens. Well, the trouble is if you don't develop immunity, then you're saying that, well, I'm okay getting the disease. And you might think, well, I won't get sick. But the trouble is you may not get sick, but then you can still spread the disease to someone else who might. And that's a problem. And so you look at the consequences of that. The only people that stay healthy are those that have been immunized. And so if you go down to the bottom, that's what herd immunity does. And if we can get herd immunity by immunization, the disease doesn't spread. Now, I do want to caution people a little bit. If you get the vaccine, we still want you to wear a mask. And the reason for that, and I've pleaded with you before to wear a mask, and I'll still plead, and I'm pleading with you to get the vaccine. Until we get everybody immunized, the risk is still possible that maybe we'll spread that. We don't know yet. Just by getting the immunization, could you carry some of the virus in your nose and spread it on? This is a respiratory virus. They talk about those viruses that are more contagious, the UK variant, the South African variant, Brazil variant. We think the vaccine is still going to work. By being more contagious, remember this is a respiratory virus. Continue to do those aspects that we talk about. Wear a mask, wash your hands, keep your distance. But this is a respiratory virus. The mask remains at the top of the charts, and I'm guessing that in the old adage where it was, well, if you have a 15-minute conversation with somebody with your mask off, you're at risk. I'm guessing the time's less than that. Those of you that are restaurant owners, bar owners, you have been square in the sights and the target of this virus. And if I were you, I would be out there banging the drum for people to get a vaccine, because that's how we get your places opened back up. That's how we get the economy opened back up in a healthy way. Public health equals economic health, and we can't get economic health until we have public health. And so, don't make a decision that might lead to a negative response. That, for instance, well, I don't think the mask works, so I'm not going to wear them, and then as a result, people get COVID. I'd ask you to make a decision for a positive result, be part of the solution here for us, and go sign up. The Department of Health has a website. They want you to register for your vaccine. When they call you, go get your vaccine. They will do the aspect of deciding when people get it. Don't make that decision on yourself. Just please go sign up and then go get your vaccine. Continue to wear your masks until this has been cleared. That's just, we got to keep it under control. We now have a light at the end of the tunnel. This vaccine, it's the cavalry. Let's take it and let's use it. So thanks. Stay safe and step up and take one for the team. So thanks.
I think it probably comes down to the personal choice of those individual companies. Here at Bryan, we have not made it mandatory to get a vaccine, and we're not paying people to get it. But we've had overwhelming response. What are we, Edgar? Right around 80% of our employees so far, and then I know the medical staff is into the high 90s. So I think that's our best endorsement that we can give to entice people to do that. Is the medical professionals and the people who work here overwhelmingly took the opportunity to do it. The requiring to get it, that's a very tricky question. All kinds of issues come into play. There are some people in consultation with their physician that it might not be appropriate to do it. So how you work through those requirements would be tricky. Again, I'll have Dr. Johnson offer his thoughts as well. Again, kind of another opinion. I think I'm going to go back to way back in May when the positivity rate was driving a lot of decisions. And I know that hospitalization rates have been certainly an important criteria used by our state here. We are vastly above those positivity rates that were concerning in the May. So we have that to work from. I do think if people wear their mask and are careful, that an element of removing the restrictions makes sense with a close eye on what it's going to do to places like Bryan and other medical centers. We're not the only ones being impacted by this pandemic, we know, but you saw what it was just about a month and a half ago where it almost crippled places like Bryan, and then that compromises the other needed care that we can provide. So are we in favor of it? I think we're supportive of what the state is trying to do. Would we prefer it be more restrictive, or would we prefer people to be even more cautious? I think the answer is probably yes. Yeah, I'm absolutely encouraged because as Dr. Johnson was going through kind of the categories of you have those that just won't get it, those that'll jump up, and there's this group in the middle that we're going to be spending considerable effort on to try to alleviate some of those concerns. But it has been an overwhelmingly positive result to see, what our employees did and the rapid sign up. Basically, now we just need more vaccine in the community and in the nation, so more people can get it. So yes, very encouraging. Without casting stones, lately we have not had a bunch of students on campus out and about. We have very good compliance, at least in Lancaster County, of wearing masks and people being very cautious and respecting this virus maybe in ways that weren't occurring earlier in the fall. I think that's what's leading to the steady drop, in my opinion. We would absolutely, if the community needs it, lift this back up. I don't know if it would be at the current location, but if the need arose, we would absolutely step back in and try to be part of that testing solution. Just want to reiterate, testing is still available at Bryan through our Bryan Urgent Cares. It's just the drive-through, the numbers are dropping, and there's other walk-up opportunities throughout the community now.
There's a difference between health and then economy, and we have to walk a very fine line there because there are people out there that they just want to work and they just want to pay their bills, and so I think that's where some of those restrictions come from, and so obviously we got to respect those things, and we just want people to, like I said, the mask. If I were to say top 10 things to do, 1 through 8 is wear a mask because it's a respiratory virus, and try to avoid those situations where you don't have a mask on. I am encouraged by the local response. I think Lincoln's done a great job. Oftentimes when we've looked at numbers, Lincoln has always been lower than most places, and so I do think people have listened and tried to be part of the solution there, and so I'm really happy with that. And I would love to see that number of people registered. I don't know how many 100,000 people live in Lancaster County, but why not have a couple 100,000 people on the registry? I know that the vaccine's not ready for kids yet, so but I'd love to have everybody that can sign up to please do that. Are they having an effect on our case numbers? No, I don't think so. There's too low of a number of vaccines that we've had yet, but every day that we have more vaccines than we have cases, then we're heading in the right direction. Just to give you an idea of time frame wise, there's probably about 80,000 people in Lancaster County that are in Group 1B, and we currently are allotted 3,900 vaccines per week. So this is why you see the Department of Health and our mayor up there asking for more vaccines, because just do the math, without a second shot, you're talking 20 weeks. The new vaccine, Johnson & Johnson, that could be a huge game changer. From what I've heard so far, I'm anxious to see the numbers, and we're really hoping that plays a role, because the more vaccines you have, the more people you can have get it. I think that the fact that the case numbers are lower reflects a little bit of our rural type of area. We were not a big place, a high number early in this, back in May, June, July. In fact, when we really got ready to take care of COVID, we were ready, but then we waited. And then October and November came, and it was awful. And it's relieving to see it the way it is right now. I don't want to go back. California was down for a while. When we were high, California was down. I think Cuomo called it whack-a-mole. It shows up. And so as long as we continue to do those important things, we can keep those numbers down. And you're saving lives by keeping those numbers down, because you're pushing this out until everybody can get vaccinated. There's a reason to push it out now. So I just really encourage people, please keep doing that.